succession to the videos what I have been taking up these days on NEET PG entrance, MDS entrance exams preparation. So from today onwards, I'll be taking up human anatomy, and in human anatomy as well as in dental anatomy, they ask you certain questions. So from human anatomy and dental anatomy, the most important MCQs what I'll be discussing is, so beginning with the first multiple choice question, because when we are studying in dental, we are mainly focused about the from the head and neck region. So from the head and neck region, when it comes to human anatomy as well as in dental anatomy, most frequently what they ask you is about the cranium. So beginning with cranium, so you must have read, or you must be very well aware that cranium consists of 8 bones, and out of these 8 bones, the unpaired bones, they and ethmoid, we can remember the mnemonic as foci, that is FOSC, foci. Frontal, occipital, sphenoid and ethmoid, these are the unpaired bones of the cranium, whereas the paired bones includes the parietal and the temporal bones. Now moving on to the next important multiple choice question was about the facial skeleton. The facial skeleton, which consists of 14 bones, and in this facial skeleton, the unpaired and the paired bones are when we look at the unpaired bones, it is the vomer and the mandible. This is the unpaired bone, and when it comes to the paired bones, we have the inferior nasal conchae, the lacrimal, the maxillae, the nasal, palatine, and the zygomatic. So these are the paired bones of the facial skeleton. Now moving on to the third multiple choice question, that is the superior and the middle concha are in the ethmoid bone, whereas the inferior conchae, it is a separate bone. So do remember, students, in multiple choice they very frequently ask you that out of the superior, middle and inferior conchae, the superior and the middle conchae are in the ethmoid bone, whereas the inferior conchae is itself a separate bone. Moving on to the next MCQ, that maxilla has 4 processes, and what are those 4 processes? That is the frontal, the zygomatic, the alveolar and the palatine processes. So these are the 4 processes of the maxilla. Moving on to the next important multiple choice question, what do we have is that mandible has 2 processes, and since maxilla is having 4 processes that we have seen, that is the frontal, zygomatic, alveolar and palatine, the mandible is having 2 processes, that is the condyle and the coronoid process. Moving on to the next important MCQ, that is the only movable bone of the skull, it is the mandible. Now moving on to the next MCQ, that is the smallest bone of the face. The smallest bone of the face, it is the lacrimal bone. I've make a star over here. The smallest bone of the face, it is the lacrimal bone. Do remember, students. Moving on to the next important MCQ, that is the largest bone of the face. So the largest bone of the face, it is the mandible, and the hard palate is formed by 2 bones, that is the palatine process of the maxilla and the horizontal plate of the palatine bones. So the hard palate, they give you in multiple choice questions that the hard palate is formed by, so they give you in options, that is you need to remember is it is formed by the palatine process of the maxilla as well as the horizontal plate of the palatine bones. Now the very important, most important MCQ, that is it is about the pterion. So pterion, it is a fusion of 4 bones. Do remember, students, the pterion, it is a fusion of 4 bones, that is the sphenoid, the temporal, the parietal and the frontal, that is the STPF. So pterion, the STPF code word mnemonic you can remember. STP is standard temperature and pressure, and so the code word, the mnemonic is sphenoid, temporal, palatine stands for STP, and frontal you can remember. Now moving on, the structure which passes through the foramen rotundum, it is the maxillary nerve. The foramen ovale passes the mandibular nerve, and the contents of the superior orbital fissure is very important. So do remember, students, what are the contents of the superior orbital fissure? So the superior orbital fissure is having the contents, that is the third nerve, which is the oculomotor nerve. The next is the fourth nerve, which is the trochlear nerve. The fifth, that is the trigeminal nerve's first part, that is the ophthalmic branch of the trigeminal nerve, and the sixth, it is the abducent nerve. So the superior orbital fissure, the nerve content of the superior orbital fissure is the third nerve, the oculomotor, the fourth, it is the trochlear, the trigeminal, the first part of the trigeminal nerve, that is the ophthalmic branch of the trigeminal nerve, and the sixth nerve, that is the abducent nerve. All right, moving on to the next important MCQ, what they ask you, it is about the mandibular foramen. So through the mandibular foramen, the nerve what passes, it is the inferior alveolar nerve. Now the infraorbital foramen passes the infraorbital nerve. Moving on to the next important MCQ, that is what is the nerve which passes through the jugular foramen. So do remember, student, it is the 9th, 10th and 11th cranial nerve. They pass through the jugular foramen. That is the glossopharyngeal, the vagus and the spinal accessory. So these are the three nerves which passes through the jugular foramen, that is the 9th, 10th and the 11th cranial nerve, that is the glossopharyngeal, the vagus nerve and the spinal accessory nerve. Moving on to the next important MCQ is about the facial muscles. So the facial muscles, they are striated, voluntary and are inserted into the skin. So they can ask you in the multiple choice question that the facial muscles are unstriated, involuntary, striated, voluntary, or they can give you multiple combinations of the above. So facial muscles, they are striated and they are voluntary and they are inserted into the skin. Now moving on to the next important MCQ, that is the motor nerve supply to the facial muscles is by the facial nerve. Do remember that the facial muscles, whatever the facial muscles are there, that is the motor nerve supply to the facial muscles is by the facial nerve. Moving on to the next important MCQ, that is the sphincters of the facial openings are. So do remember the sphincters, that is the orbicularis oris. The orbicularis oris, the sphincter of it is the oral cavity. So orbicularis oral, it forms the lining of the oral cavity. So the sphincter of orbicularis, the oral cavity, it is formed by the orbicularis oris muscle. That is the one of the facial. The next opening of the facial region, it is the ocular opening. So the ocular opening is formed by the sphincter. What is formed? It is the orbicularis oculi. So the ocular opening is lined by the ocular opening of the face. It is lined by the orbicularis oculi muscles. Next, moving on to the openings of the nasal cavity. So it is the compressor nares. The compressor nares, it forms the sphincter of the nasal cavity. Now, moving on to the next important MCQ, that all the muscles of the mastication, the mnemonic is MOM. So all the muscles of mastication helps in elevating the mandible except the lateral pterygoid, which helps in depressing the mandible. So this time, that is in the UP Public Service Commission exams, they have given you that the muscle which is responsible for opening of the mandible, it is the lateral pterygoid muscle, which is responsible for the opening of or depressing the mandible, as well as it helps in the protraction of the mandible. So they have given you this combination. See, the lateral pterygoid is responsible for depressing the mandible as well as the protraction of the mandible. Now, moving on to the next important MCQ is that the muscles of mastication, the nerve supply of the muscles of mastication is from the motor branch of the mandibular division of the trigeminal nerve, and the arterial supply, it is from the second part of the maxillary artery. So do remember, students, the muscles of mastication, the arterial supply of the muscles of mastication is from the second part of the maxillary artery. Now, moving on to the next important MCQ is about the eye. Now, do remember, students, you must be aware that the four recti muscles of the eye arise from the tendinous ring. All right, arise from the tendinous ring, which is attached to the orbital surface of the apex of the orbit and insert into the sclera. So do remember, students, that the four recti muscles of the eye, that is the superior rectus, inferior rectus, lateral rectus, and the medial rectus, all the 4 recti muscles of the eye, they arise from the common tendinous ring, which is attached to the orbital surface of the apex of the orbit, and it is inserted into the sclera. Now, moving on to the next important MCQ, the floor of the mouth is formed by which muscle? So do remember, students, the floor of the mouth is formed by the mylohyoid muscle. So do remember, it is the mylohyoid muscle which forms the floor of the mouth, and the fact what I need to emphasize is it originates from the mylohyoid line. What about the origin and insertion of this muscle? It originates from the mylohyoid line and inserts into the median raphe and the hyoid bone. So this is about the origin and insertion of the mylohyoid muscle. Moving on to the next important MCQ, that is, it is about the genioglossus muscle. So students, do remember, genioglossus muscle, it is a fan-shaped extrinsic muscle of the tongue which forms the bulk of the tongue. So this genioglossus is also called as the safety muscle of the tongue. So most of the bulk of the tongue, it is formed by this extrinsic muscle. So genioglossus muscle is a fan-shaped extrinsic muscle of the tongue which forms the bulk of the tongue. So students, do remember, this is the genioglossus muscle. It is a fan-shaped extrinsic muscle of the tongue which forms the bulk of the tongue. Moving on to the next important MCQ, that is the chief blood supply of the tongue. It is from the lingual artery. So students, do remember, the chief blood supply of the tongue is from the lingual artery. All the muscles of the tongue are supplied by the hypoglossal nerve except for the palatoglossus, which is supplied by the cranial root of the accessory nerve. All right, so cranial root of the accessory nerve, this is the which is palatoglossus is supplied by this. Moving on to the next important MCQ is the sensory supply of the face is mainly by 3 divisions of the trigeminal nerve and the C2 and C3 cervical nerves. So do remember, the sensory supply of the face is mainly by the 3 divisions of the trigeminal, that is the ophthalmic, the maxillary and the mandibular nerve, and the C2 and C3 cranial nerve. Now moving on to the next important MCQ, exclusively the sensory cranial nerves are, do remember students, it is the cranial nerve 1, 2 and 8, which is exclusively sensory. Now the exclusively motor cranial nerves are 3, 4, 6, 11 and 12. So students, do remember, the exclusively motor cranial nerves are 3, 4, 6, 11 and 12. The mixed cranial nerves are the remaining, that is 5, 7, 9 and 10. These are the mixed cranial nerve. Now moving on to the very important MCQ, and that too, it also comes in the oral maxillofacial surgery when you give the nerve out the nerve blocks. So when looking at the nerve blocks, the pulpal innervations of the maxillary teeth is as follows. So starting with the incisors and canines, they are supplied by the anterior superior alveolar nerve, that is the ASA. The incisors and the canines, they are supplied by the anterior superior alveolar nerve. The premolars and the mesiobuccal root of the permanent first molar, it is supplied by the middle superior alveolar nerve. It is supplied by the middle superior alveolar nerve. And moving on to the next, that is the distobuccal root of the first permanent molar and the second and third molars, they are supplied by the PSA, that is the posterior superior alveolar nerve. Moving on to the mucoperiosteal nerve supply. So do remember students, when looking at the mucoperiosteal nerve supply, the maxillary buccal, when it comes to the maxillary region, and that too in the buccal A segment, that is in the buccal segment, it is supplied by the anterior superior alveolar, the middle superior alveolar and the posterior superior alveolar. Moving on to the next, that is the palatal. When it comes to the palatal nerve supply, the mucoperiosteal palatal nerve supply, it is the nasopalatine and the greater palatine nerves, they form the mucoperiosteal nerve supply. And moving on to the next, when it comes to the mandibular buccal region, so you might be aware that when we give the nerve blocks, so in the mandibular buccal region, to anesthetize the mandibular buccal region, there is the long buccal nerve, and we anesthetize this nerve. This is the long buccal nerve, as well as the lingual nerve. So this is the lingual nerve. This was all about the mucoperiosteal nerve supply. Now we move on to the very, very important one-liners, MCQs for the cranial nerves. So do remember, students, cranial nerve with unique features. First, it is the longest cranial nerve. It is the vagus nerve. So this you all might be very well aware. The longest cranial nerve is the vagus nerve. The shortest nerve, it is the olfactory nerve. The largest nerve. See, longest and largest are two different things. Largest, it means in distribution of the area wise. So longest cranial nerve, it is the vagus nerve. The shortest is the olfactory nerve. The largest cranial nerve, it is the trigeminal nerve, which is having three divisions: the ophthalmic, the maxillary, and the mandibular. Now the next important MCQ, what they ask is the longest intracranial, the nerve which is having the longest intracranial nerve. Do remember, it is the pathetic or the trochlear nerve, which is having the longest intracranial course. Now the longest intraosseous course, do remember, it is the facial nerve. So the facial nerve is having the longest intraosseous course. Now, when we look at the thickness of the nerve, so the thickest nerve, it is the optic nerve, the only nerve that originates from the dorsal surface. It is again the trochlear nerve, which is also called as the pathetic nerve. So the only nerve that originates from the dorsal surface, it is the trochlear nerve, it is also known by the name of pathetic nerve. Now moving on to the next important multiple choice question, that is the four nerves that carry the parasympathetic fibers are the oculomotor, the facial, the glossopharyngeal, and the vagus nerve. So it is the 3rd, 7th, 9th, and 10th cranial nerves. These are the four nerves that carry the parasympathetic fibers. These are the oculomotor, the facial, the glossopharyngeal, as well as the next is the vagus nerve. Now, when we look at the face, the nerve supply and the arterial and the venous drainage of the face. So do remember, students, the face is having the arterial supply of the face. It is through the facial artery, and it is from the transverse facial artery. So do remember, the facial artery, these, and the transverse facial artery, these are the two branches. The two branches of the external carotid artery. It is the facial artery and the transverse facial artery. And whereas from the transverse facial, that's superficial temporal artery. So these are the arterial supply of the face. And when it comes to the venous drainage of the face, it is the common facial vein. Now do remember, the next important MCQ is movement of the lymph and the lymphatic capillaries is based on the skeletal muscle contraction. Do remember, students, it's a very, very important fact that I need to emphasize is that the movement of the lymph in the lymphatic capillaries is based on the skeletal muscle contraction. Now, the next important MCQ, there might be a possibility that lymph nodes are secondary lymphoid organs and are the major site of production of B lymphocytes. So do remember, students, when it comes to the lymph nodes, so in the lymph nodes, what are the principal cells what are being formed over there? The lymph nodes, these are the secondary lymphoid organs, and they are the major site of production of the B lymphocytes. Now moving on to the next important, the functions of the lymph. So the three major functions of the lymph are the fluid balance, defense against diseases, and the fat absorption. The next, that is 39th. So the last, I'll be just taking up only 40 MCQs in this today's video. That is the part 1. So the largest lymphoid organ of the body, you might be very well aware, it is the spleen. And the last MCQ for today, it is the largest lymphatic vessel. It is the thoracic duct. So students, this was in this part 1 video of the human anatomy. So I've covered 40 very important MCQs. From this, there might be a possibility that some of the questions can be put up in the upcoming NEET PG entrance exam. So students and viewers who are new to my channel and they haven't subscribed yet. So if you haven't subscribed, go subscribe my channel. And for if you have any queries or comments, you are most welcome to comment me in the comment section. Students who are new to my channel and they find this video helpful, do share amongst your friends. Thank you for watching.